everyone, in this video we are going to study about a homeopathic remedy called Sepia. Introduction. Common name, cuttlefish. The inky juice of the cuttlefish is used to prepare the medicine. Prover Dr. Hahnemann. Order Mollusca. It is proved by Dr. Hahnemann. Introduction. Sepia is also known as washerwomen's remedy. A small incident which took place in Hahnemann's life which led to the discovery of this remedy is given below. Hahnemann got the clue to initiate proving of this remedy from a patient. So a patient came to his clinic who had the regular habit of wetting his brush containing Indian ink with his own saliva. The artist used to dip his brush in the Indian ink and again with his own saliva. Each time he did this, a small portion of the ink used to enter his stomach and was absorbed by the system. This led to the development of some chronic ailments. Hahnemann tried to cure the case with the best known simillimums to the best of his ability, but it did not show any appreciable benefit. Then he expected that the dipping of the brush in the Indian ink and with his own saliva might be the maintaining cause. Expecting this to habit, he advised the patient to discontinue his profession. The artist obeyed Hahnemann and he was completely cured from the chronic ailments. This unique pleasant experience ultimately led to prove Sepia for the benefit of the generations of the mankind. So, this incident, when the person stopped taking the Indian ink, he was cured with the chronic ailments. This incident made Hahnemann to prove this remedy. Sphere of action of Sepia. Sepia acts on the female genital organs. You can see here the female genital organs, gastrointestinal tract, glands, endocrine system, nervous system. Sphere of action continuation, liver and portal system. Portal system, either side capillaries and between there will be large blood vessels. Skin. So the sphere of action, female genital organs, GIT, glands, nervous system, liver, portal system and skin. The constitution of Sepia. Sepia is suited to tall, slim women. You can see the picture here, tall and slim women. A woman who has the hips of a well-built man and is not suitable for childbearing. She cannot perform the functions of a woman. You can see the pelvis here. It is like that of a man. She cannot perform the childbearing function. Since the pelvis is like that of a man, there might be a threat of abortion here. Such a build is the Sepia build. Very tall, slim, narrow, straight, from the shoulders all the way down. You can see she is tall, slim and narrow. From the shoulders all the way down, she is tall, slim, narrow. And the pelvis is that of a male. Weakness, yellow complexion, yellow conjunctiva, bearing down sensation, especially in a woman with a telltale face. You can see here there is weakness, yellowish complexion and the conjunctiva is also yellow. It is women with a telltale face. Telltale face means the people who depict a story on their face. Looking at their face, you feel that they want to tell you some story. Their sadness. Tendency to abortion. Since the pelvis is like that of a male, there is a tendency to abortion in Sepia. Hot flashes at menopause with weakness and perspiration, that is sweat. During menopause, there are hot flashes, weakness and sweat. Temperament, nervous temperament, thermals, patient is chilly. Miasm, antisoric, antipsychotic. You can see here the Sepia patient, she is chilly, nervous temperament and the miasm is antisoric and antipsychotic. Now we are going to learn the mentals of Sepia. Sepia is extremely nervous. Indifference runs through the whole drug. She is indifferent to everything, to her own occupation, to the members of her own family whom she loved once. So, there is indifference to everything, to her work, to her family members, to her husband, to her children, to her domestic and personal affairs. Also, there is indifference. The patient is very much irritable and offended. You can see the picture here. She is indifferent to her own husband. The patient is very much irritable and offended. She cannot narrate her symptoms without weeping. Sepia is very emotional. She cannot narrate her symptoms without crying. The same is found in pulsatilla and medorinum. She is indolent, does not want to do anything, either to work or to play, even cannot afford to think. Indolent means avoiding. They do not want to do any sort of work. Neither they want to play. They don't even want to think. That level of indolence is found in them. See, the person is indolent. He does not want to work. Hope the mentals are clear. She is nervous. She is indifferent to work, family, personal affairs, domestic affairs and everything. Third, there is indolent to the work, play and even she cannot think. And there is weeping found. Even when she narrates the symptoms, she is going to weep. She is anxious and fearful. Flushes of heat over the face and head. Sepia patient, she is anxious and fearful. Thinks about evils, real or imaginary, towards the evening. Towards the evening, the Sepia patient is going to think about the evils. The evils could be real or in the imaginary way. The patient always has a great sadness and weeping. As we read in the previous slide, she cannot narrate her symptoms without weeping. So there is a great sadness and weeping. There is also great dread of being alone. So she fears of being alone, of men, of meeting friends. There are fears of men, fear of being alone, fear of meeting friends. She cannot bear tobacco in any form. There is a great intolerance of tobacco. Tobacco, smoking, any person smoking, Sepia cannot take it. The woman, she has aversion to tobacco in any form. She is very greedy and miserly, absent-minded, memory is weak, unable to recollect thoughts. So, one, she is greedy and miserable. Along with that, there is absent-mindedness, memory is too weak, she cannot recollect the thoughts. You can see absent-mindedness, weak memory, unable to recollect her thoughts. Consolation is going to aggravate her mental condition. So whenever you're consoling the Sepia patient, it is going to aggravate the complaints. So there is an aversion to consolation. In this slide, we learned she has aversion to tobacco in any form. She is greedy, absent-minded, weak memory. She is unable to recollect her thoughts. Consolation is going to aggravate her complaints. The disposition peculiar to Sepia is a depressed, anxious, fearful state of mind with a sense of helplessness and yet susceptibility to excitement. You can see, guys, she is depressed, anxious, fearful, yet she is susceptible to excitement. She feels she is helpless. There are frequent attacks of weeping and despair of life, says Dunham. Along with the depression, anxiousness and fearful state of mind, the person is going to weep, there is despair of life, and along with that, there is excitement as well. Now we move on to the ailments of Sepia. Exposure to cold. You can see here, exposure to cold, laundry work, tobacco in any form, alcohol, wetting before and during menses. These are the ailments: exposure to cold, laundry work, tobacco and alcohol, wetting before and during menses. After eating, coitus, going upstairs, change of weather, and also cold air. You can see the ailments, a summarization: exposure to cold, laundry work, alcohol, tobacco, wetting before and during menses, coition, after eating, going upstairs, change of weather, cold air, milk acid and fats. You can see ailments from the milk, acids and fats before thunderstorm. With this, we come to an end of ailments of Sepia.